Hi, my name is Emily Perez, and I'm going to be talking about manual therapy, a little bit about the benefits, what it is, and some risk associated with manual therapy. So, first of all, manual therapy is a specialized form of physical therapy that uses passive and skilled movement applied by certified clinicians that directly targets a variety of body parts, specifically neuromuscular body parts and disorders. So these hands-on techniques are used to diagnose and treat a multitude of neuromuscular disorders. Some of these disorders can be from neck and back pain, fibromyalgia, headaches, migraines, TMJ disorders, pain in the knee, ankle, hip, shoulder, muscle strains, and sprains. So, an aspect of this manual therapy involves these therapists using their hands to manipulate joints, muscles, and soft tissue, thus reducing pain and increasing range of motion to improve the overall function of the individuals. Um, with the intent to create a beneficial change in the patient's experience and overall function of life. Collectively, the process of manual therapy is to enhance patient management for disorders by influencing a multi-interdisciplinary perspective. Some of these techniques that are used in the manual therapy are hands-on techniques, which is basically when the therapist use their hands to apply specific either circular movement, deep pressure, to manipulate the joints and soft tissues. Moving on to joint mobilization and manipulation, somewhat like the hands-on techniques, but it just moves the joints and manipulates them past the normal range of motion to help improve mobility and reduce restrictions, either through contractions or previous injuries. Soft tissue mobilizations improve the mobility and function of the muscles, ligaments, tendons, and other soft tissues through these hand techniques. Muscle energy techniques are used when it involves a patient actively contracting and using their muscles against resistance to help promote muscle function, growth, and then reduce the pain that the individuals are feeling if it's muscle related. And then a neuromuscular technique, which is basically helps improve the body's awareness to movement, reducing pain, and improving overall function. And lastly, trigger point therapy, which applies specific pressure points to release tension in muscles. With all of these therapies being utilized, it obviously prevents, it comes up with benefits and obviously risks. But most associated with manual therapy is going to be the benefits. So I'm going to go over some of the benefits now for manual therapy. A big one is pain relief. So, and by doing manual therapy, these individuals come to the therapist with target discomforts and underlying issues, which are alleviated, improving circulation and alleviating pain. Another one is improved mobility and flexibility. Joint mobilization, like we were talking about before, and soft tissue mobilization can improve joint flexibility and muscle extensibility and stretching. By addressing the restrictions in the soft tissue and joint mobilization, it can enhance the range of motion, allowing for a more fluid movement without any restrictions. Particularly beneficial, like we were talking about, for stiff joints or limited flexibility due to injury or overuse of the muscles. And lastly, for big ones are to reduce inflammation and improve healing by addressing underlying causes of inflammation with manual therapy. It can contribute to a sustainable recovery that increases blood flow to the injured tissues and speeding up healing processes. A couple of other minor benefits, but still beneficial, is that it can improve posture and balance with the therapies that are being used. Realigning the body, improving posture, balance, and stability, while also reducing stress by reducing the muscle tension and promoting relaxation. It can help lower stress levels and induce a sense of well being in the patients. Um, it can also, this is a big one, and it can improve the function and the quality of life that these patients have, like by addressing the pain and improving the mobility, the balance. It helps these individuals regain a functional ability to improve their overall quality of life. Now, moving on to the risks. Like any therapy, there are benefits and risks associated with them. These risks are minor, but can happen. Some of these risks would be muscle soreness and stiffness, which is a common side effect after mobilization and manipulation and stretching of these joints and muscles that haven't been stretched before, or not, they haven't been stretched the way that you are stretching them now. Headaches sometimes after like neck manipulation or like pressure point therapy, dizziness or lightheadedness after the neck or pressure point therapy, radiating pain sometimes from like the mobilization, the trigger point therapy, and an aggravation of symptoms is a little bit more common just because you're aggravating that one muscle, joint, soft tissue that's hurting you. So sometimes it can lead to a little bit more pain before the pain kind of like comes down and decreases. And then in severe cases, it can cause, the manual therapy can cause vertebral injury, fractures, strokes. But those are the very like small risks for it. So in conclusion, by allowing manual therapy to be applied to joints, muscles, nerves, soft tissue, it aims at treating the patients, improving their overall quality of life, pain reduction, increasing rates of movements and nerve mobility, and with an overall goal to restore normal function.